Dr. Paul Teich here, www.drpaulteich.com, and of course I'm talking to you today on YouTube. Today's subject is inflammation. People say, oh, I can't even say the names of the different medical and over-the-counter medications that people would take for medication. One of the first things I always bring up is pH therapy. I have a special form of it that I use in the office, and of course is Dr. Young's work. Brilliant. Everyone should look up pH therapy and understand what that is. I get a minty green liquid that is composed of organic alfalfa sprouts, and if anyone thinks it would be bad for them to have the equivalent of 5 pounds of organic alfalfa sprouts in their diet every day, and that would be bad for them, then they should just continue to eat their fast food and stop taking vitamins. That's the one best thing that every nutritionist can do to every patient. I have an inflammatory condition. What can I do? Well, it has certainly been found that eating curry, and here I am in the beautiful Indian room of our Philadelphia office, and curry has been found, which is composed of 4 or 5 different spices, is extremely anti-inflammatory, can even cut down headaches, and eaten 4 to 6 times a week severely cuts down the rate of any type of heart problems. I have an inflammatory condition. There's 1,107 of them. Everyone should be on some type of anti-inflammatory therapy. What can I do? You might get a hunk of ginger. It's a root. If you're hardy, I would bite it and I would suck on that all day and always have a piece in my mouth. A long time ago, the Emperor of China was ill, and they brought in doctors to heal him. When they did not heal him in a certain period of time, they would kill the doctors. Eventually, they brought in a doctor who recommended ginger, and the emperor got better, and all the way to today, from thousands of years ago, ginger, prized for its myriad of healing qualities in China. And it is extremely anti-inflammatory. I have an inflammatory condition of which there are thousands. What should I do? I might, for them, of course, recommend a regular array of vitamins, which you can find on my vitamin segment. But there are certainly things people can do. They could use an ice pack. That's pretty famous. If they don't have it, they could use frozen peas or frozen corn and put that on top, and then when it feels it's getting warm, turn it over and put that on if they can't have or can't afford an ice pack, and then afterwards you eat it. It's not good to refreeze it. I have an inflammatory condition. What can I do? We have mentioned curry, we have mentioned ginger, we have mentioned an array of vitamins, we have mentioned pH therapy. These are some excellent and terrific things that can be done for the inflammatory process. Further, in coming to a practitioner like me, we could use transcutaneous electric nerve stimulation, the TENS pads. We could use electric acupuncture. We could use cold laser therapy. These would be more expensive and things a therapist would do on you for an inflammatory condition. If I picked one vitamin to mention, I might pick glucosamine and chondroitin sulfate with molybdenum, vitamin C, and MSM in it. Now, they never put enough MSM in it. You can look that one up, the miracle of MSM. You'd need 6,000 milligrams a day, and they put in 800, which is nice. When we take our glucosamine and chondroitin sulfate with molybdenum, vitamin C, and MSM in it, which is going to help many things like clear out arthromatous plaques from our arteries, cut down inflammation, and speed the healing reaction in the body. All good. When we look at that bottle, it should come from one of the 5% of companies that actually sell good vitamins. The glucosamine and chondroitin sulfate should be in 1.2 to 1.5 grams. Grams, not milligrams. It has to have molybdenum in it to help the body to metabolize it correctly. It has to have vitamin C in it to help the body metabolize it correctly, or else you have to go out and buy your own bottle of molybdenum and your own bottle of vitamin C, and then you're probably going to be paying 3 times as much. So that which I use and you can get from me has all of that in it without it costing an extra $20, because I have researched the best companies to get from. I'm a patient too, and I even have to sell for $1 less than the stores. In any case, I have an inflammatory condition. What can I do? We can certainly eat those foods. We can certainly take a vitamin or two. And had I an inflammatory condition, I might also want to go swim or relax in a pool, because it's going to be cool. I want it to be 75 degrees or less, and if I'm in there long enough, it's going to have an anti-inflammatory reaction like putting ice on. Of course, ask your doctor before trying any of this. I wouldn't want anyone to hurt themselves. So, from the Taj Mahal, Dr. Paul Teich, www.drpaulteich.com, signing off. Have a joyous day.